Good morning, everyone. Thank you for having me. I'm thrilled to be here and to really be able to celebrate work that is so necessary to do. I want to thank Senator Reid, thank First Gentleman Andy Moffitt, thank Amy Nunn, and Mayor Elorza as well. This fits perfectly with the strategic priorities framework that we talk about at the Rhode Island Department of Health. Two of the three of them really focus on addressing social and environmental determinants of health, as well as eliminating disparities and promoting health equity. This achieves that. I appreciate how Mayor Elorza mentioned how interdisciplinary and how strong this coordination is at the state level, at the national level, at the city level, with the Department of Health, addressing it with the Food Policy Council, with the Rhode Island Public Health Institute. This is the way that we're going to address social and environmental determinants of health. We have to partner together. Food is such an important element. Having healthy foods available in every environment, knowing how food contributes to education, how food contributes to us having a healthy workforce so that we can build our economy. It's a central element in us addressing all elements of health that we want to, as well as elements of living as a state. We also work closely with Director Janet Coit at the Department of Environmental Management, who also has a strong food component. And this is truly a statewide initiative that is powerful. It's an economic tool, it's a public health tool, it's an environmental tool, it's a community-based tool, and it's a necessity for what we all need. When we talk about health equity at the Department of Health, I like to describe it as saying one's life expectancy, health outcome, how long someone lives, should not depend on the zip code they're from. Everyone should be able to live. They should be able to live the healthiest life they can live and in the healthiest communities they can live in. And that's really what I love about this initiative. It's making sure that all communities have the same access to healthy food and vegetables that exist. We need to have full-service supermarkets. We need to have these groceries that are so necessary for our children as well as for our adults, those who are being educated and those who are working. What we know is that 85% of people with incomes under $50,000 per year do not eat the recommended number of servings of fruits and vegetables per day. That's what this and other initiatives in the state are looking to change, because we have to. We also know that people with lower incomes are more likely to have chronic diet-related health conditions like obesity and diabetes. These type of changes can make a difference in that. If someone's household income is lower than $50,000, they are 2 times more likely to have diabetes than someone with a household income that is greater than $50,000. Though those numbers exist, that doesn't mean that there isn't hope. Coming together today shows that there's hope and there's something that we can do about it, making sure that everyone has access to healthy food and vegetables. What we need here are organizations that are not afraid to think boldly and creatively, and if there's any example to the essence of thinking boldly and creatively, it is Amy Nunn. So being able to partner together, for all of us to work together at the state level, really emphasizing how important this is for our communities, for each and every person in our communities, is what this is all about. By focusing on low-income or low-access neighborhoods in Rhode Island's core cities, the way the Food on the Move initiative is doing, we will promote community health and help eliminate health disparities. We really want to achieve health equity so that everyone's life expectancy outcome will be the best it can be in the best communities that it can be in. So we applaud this effort. We're fully on board and ready to partner from the Rhode Island Department of Health, and are eager to support in every way we can. Grateful to be here. Thank you for having me, and thank you for being a part of this important program.